Lovely to see you all. I know it's been a little while. Um, as you know, today we're going to be speaking with the wonderful Dr. Karla. So I'm just getting her up on our screen today in order to have a useful eye, which I'm sure lots of you will have a million questions. I know I would, especially with listening to Dr. Karla. She's an absolute guru when it comes to eyes. So, but yeah, I'm sorry it's been a little while since I last saw you. It's just been manic. I think as well with Easter and people having their kids off at school, it's just been a bit difficult to work around it. But yeah, we're back and it's going to be absolutely amazing. Absolutely fantastic. And we're going to have so much fun. So make sure that you have definitely made sure that you have lots of questions because Dr. Karla and I will be going through all of them, which I'm sure, I mean, the amount of times we both get questions about, what to do with the eye, etc. Oh, it looks like we're having a slight problem because Dr. Karla seems to be having some problems joining. Well, that's not helpful. Let's see what we can do. Apologies for this. I know we want to keep you all going and making sure that we don't waste your time. Let me just try again. I'm sure she can join. So we'll just double check that. There we go. There she is.
Hello.
It was saying you were unable to join. I was like, I'm sure she is able to
Yeah.
join. How are you?
I'm good, thanks. And you?
I'm really good, thank you. And I'm really excited to have a proper talk about youthful eyes with you because you're an absolute guru when it comes to the eyes and what to do with the eyes. But first of all, we'll introduce each other and then we'll start off. So, as people already probably know, I'm Dr. Victoria Blackaby. I run my own clinic up in Leeds. I'm actually still an NHS doctor, so I work as an ears, nose and throat doctor, which is predominantly surgery on the nose area, but also I do a lot of facial aesthetics, and I trained at Harley Academy, which is obviously where I met you.
Yes.
And go ahead, Karla, it's all yours.
Perfect. So my name is Karla. I'm a doctor and I'm also ophthalmologist, and I work at Moorfields Eye Hospital. I've been working there for about 4 years now, and I do medical retina, cornea surgery, and now for the last 3 years I've been working with medical aesthetics, and I was trained again as well in at Harley Academy, and now I joined this year as a clinical trainer.
Absolutely. And we see each other quite often as well, don't
Yes.
we, at Harley Academy, and give each other a little wave because
Yes.
you'll be teaching and I'll be doing a gold clinic as part of my gold scholarship. So it's really nice to always just catch up with you as much as we can, especially when I have questions about the eyes, because as you can see from everything that you've done over the years, you are an absolute eye guru and I can't wait to hear more.
Oh, thank you. I
So
always
what?
ask you about the nose.
Oh yeah. Well, that will be a next one at some point. But what we'll do is, so I'm sure everyone's got a load of questions about what we mean by youthful eye, and everyone's got different ideas of what we mean by that. But for me personally, it's having that brightness, addressing any changes that are happening as a consequence of age, which we all go through, and we all go through changes in around the eye at different stages in our lives as well.
Yes. So youthful eyes to me mean bright eyes. So you were very good at that point. So bright eyes means that when someone looks at you, they're gonna see your eyes rather than around your eyes. So they're not gonna be paying attention to your skin that's folded a little bit or your hooded eyes. Also, the position of the eyebrows is really important. So nowadays we are having this technique to put eyebrows up because this is also another sign of youth and another sign that you have healthy area. And the reason is, for example, if you notice years ago, we used to have very thin eyebrows. And then this makes us look a bit older because there is a lot of exposure here. And what we need is a little bit of hair, but a little bit of skin. So if it's too much skin, then it's not very good. But then if also it's too little skin, for example, when there is a drop in the eyebrows and there is hooded eyes, then we don't look young.
Absolutely. And I think it's really important because I'm sure you get questions as well from patients where they say, I want to come in and I want to have tear trough filler.
Yes.
I want to come in and I want this done to my eyes because they've seen some advert or a social media influencer talking about one specific thing, and they've said, okay, if I get that, I'm gonna suddenly have these bright, youthful eyes. When actually we both know that we usually require a lot of different things to address different parts of the eye that are all contributing to that aging look, or changes around the brow, as you say, which or the cheeks, which will have a massive impact on how youthful we look.
Yes. So there are two things that my patients sometimes come and they say that they want, and I'm saying this is the last thing we're going to do. So the first thing is lips. Second thing is tear trough. And the reason I say that is we need to get a good foundation, a good structure. Because imagine it is like a building. When we are building, if we don't give a good structure, it doesn't matter what we put on the top, it's going to collapse. It's not going to look good. It's going to be to the side. So we need to give a good structure. And how do we do that with our eyes? The first thing is a proper consultation with a doctor, a medical professional, dentist, nurse. So it's very unregulated in this country, and unfortunately, especially around the eyes, because it's a very difficult area to treat. We see lots of complications and lots of poor outcomes. And in the end of the day, if you have a poor outcome, people are going to pay attention to the outcome rather than to anything else that's looking good in your skin. So first thing that I always say is sunscreen. We forget to put sunscreen in these areas. So sometimes we put sunscreen around this, and then this is something that we forget. Also, I know that many people don't even apply sunscreen. So this is the first thing that we need to address, because this is our skin, and we know that photo aging is what helps the most with aging process. Then we need to assess the full face of the person. We cannot just assess the tear trough or the position of the eyebrows. The person needs to have a good foundation in the face, and this means good skin. This means good volume in the face, because we know that as we age, we lose volume. And the first area that we're going to lose volume is this one. So if we don't address that, there is no point for me to put a tear trough filler, because then you're just going to have a bump or a lump look like.
Absolutely.
And sorry, you can say.
No, I completely agree. In my clinic, patients always have to come in as a face-to-face, because I need to see what the underlying problem is with the eye.
Yes.
And it may not be one specific issue. And so quite often I will address the skin, because if it's crepey and papery, it doesn't matter what I put underneath the eye, because you're never going to get the result you're looking for. And quite often, as you said, I will end up addressing the cheeks first and the volume to the middle part of our face.
Yes.
Before even looking at doing any kind of filler around the eye.
Exactly. That's 100%. So majority of my patients that come for tear trough, I never do the tear trough. Never. And the reason is they have loss of volume in the cheeks. And then this area, first the apex of the cheek, which is very related to youth signs. So then once we apply the cheekbone filler, which is deep and is going to give a good structure, it's going to be better looking. Then when we do treatment for this area, which is the mid shade, it's not even the tear trough. So if we put the filler in this area, deep there, we are going to have a very good result without the need of tear trough filler. And the reason is we are losing volume. And then when we think about this area, it's because it collapsed, because there is no structure to hold it. So majority of my patients, zero filler in the tear trough.
Yeah.
And the way that I can do that is by explaining these things to them. Because if they come to clinic and say, oh, I want my lips done, and then you go, oh, you actually need your cheeks, it's the same thing as doing tear trough, just a way to explain better to the audience. And then I explain the foundation, and then if you have a good rapport with your patient, then we are able to do that. So as a consequence, I always treat the mid face first. And then this is when we are thinking about more advanced. Because before, we need to address the skin. If the person has pigmentation because of sun damage, if the person has change in the skin quality, it doesn't matter what we put, the person is still gonna not be happy. And in the end of the day, what I want is for the patient to be happy when they look at themselves. It doesn't matter if I am happy if they are not happy. So I think
Absolutely.
this is the main thing that I do in my clinic, is this that I'm going to do, is this going to make the patient happy?
Yeah.
So then that's why we need to explain, because then once they understand, they are going to be happy about what you're doing, and then the outcome tends to be better. So then we need to treat the skin. So the first thing that we can use is hydrants. So moisturize the the eye area, sorry. So there are specific products and they don't need to be very expensive. We have products that can help the eye area. So one thing that I always find that's interesting, there are some products, for example, they have a roll-on shape that when you apply in the morning, it helps with puffy eyes. Because with age as well, we tend to have more accumulation of liquid. And then when we wake up, it's like, what happened there? So another thing that you can do is apply cool compresses in the morning, because this helps with vasoconstriction. And then this is a very good tip, because under eye pigmentation, we say, oh, we have dark circles. The reason why, there are many reasons why we have dark circles. And one of them is this vasodilation that we have. So if you put cold compresses, like I think when I used to be a kid, or when I was a kid, we were like, oh, let's put some cucumber. And then we had this idea, we didn't know why, but this really works. And the reason is the blood vessels get constricted. So then there is less appearance of dark circles. And then this is really good. And this is just doing every day. And then not doing anything else in terms of treatment, no creams, nothing. Just by putting something that's a bit cold. And then this makes you look a little bit better. So then when you have this roll on and then they are a bit cold, then you're having two things already. So you're helping the drain of the liquid, and you are causing the blood vessel constriction, and then you have less puffy eyes, less dark circles. And then this helps a lot. Many people come, oh, I want to do tear trough because I have dark circles. And then I always think, what's the reason for that?
Absolutely.
Why do you have dark circles?
And I think that's really interesting what you say about with the tear trough. It doesn't necessarily mean you're going to affect the pigment changes that are occurring underneath the skin in that area. So if your main concern is dark circles, it might be that a tear trough treatment isn't actually for you.
Exactly.
And I always, as part of the consultation, talk about general health as well. So, how much sleep are you getting?
Yes.
Are you keeping yourself hydrated? Are you a caffeine freak like me, and you're constantly drinking cups of tea and coffee? Because all those things are going to impact your skin as well.
Yes. Yes. So first things first, I totally agree with you. Are you having a healthy diet as well?
Mm.
Sometimes we forget about these things and then we just want a quick answer for that. But the foundation again is what's gonna give you the best result. So we need to act on different pillars. So when I think about any of my treatments, but especially around the eyes, because it's such a difficult and delicate area, we need to think what is contributing. So as you said, general health, there are some diseases that cause changes in our eyes. So that's why first thing is important to see a medical professional, because when I see the patient in the waiting area, I'm already examining my patient. So for example, the other day I had a patient that had a sty, and we were talking and she came for another treatment, and I said, oh, you have a sty, you need to address that. And he said, oh, but this doesn't concern me. And by the way, tomorrow I'm going for eyelashes application because it's going to be my birthday. So then I explained first why she was having a sty. Second, about the risks about doing this type of treatments or cosmetic things. So I really don't think that our patients and many patients are being looked after when they see non-medical professionals.
It's
And
interesting you say that as well, because I find because we are under a body, so we're under the General Medical Council as we're both doctors, dentists are under the GDC, nurses are under the NMC. Our main aim is to do no
yes,
harm. So if we see something, we're not just looking at your eyes and saying, oh, yeah, you want some tear trough filler, here you go.
yes,
That's it, on your way, we'll take your money. We're actually looking at you as a
yeah,
whole and making sure that we do no harm and we provide you with the best possible care. And I think you're completely right. If you do not see a medical professional, I say all the time, please be careful where it says medically trained, because that does not mean that they are a medical professional. They've just gone to a course where they have had training by a medical professional, not that they're a medic. And they have a completely different perspective compared to us, because
yeah,
we have gone through that training to understand all those aspects about the eye and the rest of the
yeah,
face, neck, chest, wherever you're working, in order to provide the best possible outcome for our patients.
yes. So imagine, for example, for the eyes, if you have a kidney problem, you may have puffy eyes. So I'm not a kidney specialist, but I have the background of knowing how the body works. That I may think, oh, it doesn't really look just because that person is not sleeping well. So then before doing anything, and then when I say before doing anything, it's not even thinking about doing anything. Because my main aim, and this is really true, it's not money. Where I see that many non-medical professionals are thinking about. My main aim is not getting new patients. Whereas you see that if you have this type of treatments, you say, oh, you look nice, or oh, this person was good, so then you go there, you get more clients. That's not the aim. So for me, my consultations are medical consultations. They are not beauty consultations. And this needs to be very clear to the patients. And unfortunately, it's really difficult. As you said, oh, medically trained or medical whatever, they say in the UK and especially here in London, Harley street training. I'm like, what does this mean? Just because you are in a street that many years ago was related to doctors and good doctors or doctors that were living there above or below their practices. This used to mean that they were there for the patients. Whereas I'm seeing now, and I just had the treatment that I did for a patient for a complication, that she was treated by someone, I don't know the background, and the person didn't see the complication and didn't even say, okay, there may be a complication, I don't know from what you're saying. Come to see me face to face, and then we can address. So this is what I mean about being a doctor, is addressing the patient as a whole. If you think they may have a kidney problem because the eye area doesn't look nice, go to the GP, address, and then we can think about something else. Because the first thing is do no harm. Second thing is thinking about the best care that you can give to the patient. And if I don't know, because no one knows everything, then we can think, okay, someone else can know, someone else can treat you. Then you can come. And I think the patients appreciate that.
Absolutely. I think we're so honest with our patients, and sometimes it's not that it's not liked, but I think they're used to, because they're paying for a treatment, they expect that treatment.
Yeah.
But that is the bonus of going to a medical professional, is they are going to be completely upfront with you.
Yeah.
They are going to tell you if something isn't quite right. And also, because we're doctors or dentists or nurses, we like to stay on top of what is evidence based.
Yes.
For our patients. And with the youthful eyes that we're wanting to achieve, there is so many other options that are now available on the market.
Yes.
And those types of treatments can also be used. So for example, I might address the skin and then address the mid face, as we said, with some cheek filler. But then for the under eye, before thinking about having tear trough, if they are eligible and appropriate for treatment, I might be looking at something like polynucleotides for the under eye.
Definitely.
And it's that thinking outside the box that's absolutely vital when looking after these patients. Because for those that don't know, both Dr. Karla and I, we use polynucleotides. And what they do is they are helping your body to regenerate itself, produce its own collagen, address the skin. And that in combination, a bit like a cocktail of
Yes.
different treatments, that's when you get the best results, isn't
Yes.
it, Dr. Karla?
Yes, so what I always think is, especially for polynucleotides, is we are creating an investment. So this is our bank of collagen, fibroblasts, things that can help us in the future. It's not something that's right there at that point, but over time we are losing collagen, for example, and fibroblasts. They help with the elasticity. And this area is so delicate that once we lose this elasticity, then we see that lines that we cannot treat with anti-wrinkle treatments. I have many patients that come and say, okay, so today I came for my anti-wrinkle treatment, which means normally the three areas, which is the frown area, forehead, and these crow's feet lines. And they say, oh no, but I want a bit of Botox here because these lines are also bothering me now. And the reason for that is they don't know what's happening. They don't know what can be done. Unfortunately, I really wish we could do anti-wrinkle treatments in this area. But the problem is if we relax the muscle that's around this area, which is called orbicularis oculi, there is a risk of you having this, which means that you're going to have exposure of your eyes, you're going to have dry eyes, and then you can have very big consequences to your cornea, which is the transparent part that's on top of the colorful part. And then we're going to be creating a complication that is not needed. So then do no harm. So then what can we do to treat this area? To me, this is the most difficult area to treat in aesthetic medicine in the face, because we cannot put too much. There is not much that can be done, even in terms of lasers, which I think is one of the tools that we can get to treat this area. So polynucleotides came to change a little bit the things there, because they are increasing the quality of the skin when we change these little bits in the DNA, because this comes from a salmon DNA. So they are going to address and stimulate some cells production, stimulate collagen, which is really good for our skin, and we start to lose around when we are about 30, 25, and then each day we are losing more collagen. So this is really good, because then this is regenerative medicine rather than just treating something that's there and treating now.
And I think, especially when I start introducing polynucleotides to a patient's treatment plan, I'm very upfront that this isn't some kind of quick fix. You're not going to have that treatment and suddenly all this collagen is going to come out of nowhere into your under eye. Because that is sometimes a perspective that patients have, that it's going to be like a filler, but it's not at all. And as a professional, we say to patients, okay, well, you might need a course of 3 or a course of 4. However, that does not mean that at that point the issue is going to go away. It might be that we have to tailor it slightly different to you. We might need to extend that treatment. We might need to look at other treatments on top of it in order to address it, because nobody's got a crystal ball.
Yes.
And that's where, being professionals, we look at all these different options. And we look at all of those before we get to the tear trough filler, in order to ensure that we've addressed all other aspects before doing that. And one of the main reasons we do that is because, as you said, it's a very delicate, intricate area. You have to know your anatomy. You can't learn how to just do tear trough and learn all the anatomy and how the eye works and eye conditions in a one-day course.
Yes.
Yes.
And
go on.
Knowing how to treat the complications. First, how to avoid doing complications, because this is the main aspect that I think when we are doing treatment, I think this is the same with you. First is doing no complications. So we do everything. So this starts with cleaning. And I see horrible things online. For example, people even post this on Instagram. How people can leave the eye count. I clean and I clean and I clean and I clean. And the reason is I don't want an infection. I'm putting something that's not even a medical treatment. This is a cosmetic treatment to the patient. So clean. And we see lots, I don't know, probably you've seen multiple people doing even plastic surgery with no sterile gloves, not even wearing masks or anything. So if you think about these basic things that they are not doing, imagine others. Then this is one fact. Second is the choice of the product. We cannot go to a one-day course and say, okay, so this is what you do for this. You just do anti-wrinkle in this area, then you do the tear trough, and then polynucleotides, done. It's not like that. It doesn't work like that. And this is what we can imagine in one day. I don't think I've ever learned anything in one day.
I don't think I've learned anything in one day.
Exactly.
And it's interesting you say about the cleaning, because I've had a few patients that have come from non-medical professionals, and a good proportion of my treatment is cleaning. I continue to clean and clean, and as someone that does surgery, I will continue to clean until I know There is no makeup, there is no debris on that skin before I do anything.
Yes.
And they go, God, this is taking
Yes.
ages. It doesn't usually take this long. And you're like, yes, because I am cleaning your
I
skin so
know.
that you don't get an infection.
That I think this is being a surgeon. I think for me, I always imagine I'm doing like a surgery to the patient, because it is. If you are putting filler in someone anywhere, if you're putting until anything, it is a procedure. So it doesn't matter. We have our skin to protect ourselves, and then we are breaking this protection.
Yeah.
So once you have this break of the protection, there is risk for any infection. And this is for everything. If you hurt yourself, you can have an infection. Of course, thank God we have this immune system that helps us. Otherwise, we would have much more complications from many people. Even for us that do a very good cleaning, and even for surgery that everything is sterile, the room is sterile, everything, then we can still have infection. But imagine if we don't do the basics.
Absolutely.
So I think it's really important that we know how to do it. That's the first thing. So this means cleaning, choice of product, and avoiding complications. For example, if you inject tear trough with needle, these give me palpitations.
It sounds like you have the same frightful experience when people inject around the eyes as I do when people inject around the nose.
Oh my God, when I see this, oh, tear trough with needles, I'm like, and then I just saw an article about a person that had tear trough filler with needle and got blind. So people forget these treatments have high risk.
Mm-hmm.
So I don't understand many things why. First, there is no regulation in this country. Second, how people can sleep after they do these treatments, and how the population is still not educated. And I think this is multiple people fault, doctors fault, government fault, because the population doesn't need to be, cannot be educated if we don't educate them.
No, and I think we don't talk about this as part of a youthful eye to put a negative spin on it, or to say to people, oh, don't have tear trough filler, don't, it's awful, all these things can happen. As part of our consenting process as doctors, we will try everything possible to reduce those risks.
Yes.
We will try other options that may be safer first.
Yeah.
To see if we can improve it before having to go down this route.
Yes.
And then also, we will get to a point where if we are going to do that, we will do absolutely everything possible. Because if you can imagine, for people at home, if you're having a filler, which is essentially a foreign body that we're injecting into a very delicate area, there are really important structures around that area that need to be looked at. And one of those is the eye, for example, if you're doing tear trough. And people will know when they've had their lips done, sometimes the lip filler can migrate. There is absolutely no reason that cannot happen to the eye area. Isn't that right, Dr. Karla?
Yes. So there is a very interesting study, because when I started, because this area is my background area, I was very curious about the tear trough, because also it came so popular. I don't really understand why it's so popular, because it's, if in, at least in my experience, it's so little that we should do. But then I started reading. So there is an article that's very interesting, that people did research about people that had tear trough. So first, how long it lasts. So these studies are showing that fillers last so much longer than we think. And this is anywhere in the face. So we saw in this article, they showed 12 years fillers around the eyes. And one person, and then they did MRI scans. So this is proven that the filler was there. So even behind the eye, so this means behind the bone and behind the eye, fillers that's been there. So we don't know if this was put there or if it migrated, possibly migrated there. So we need to think about other things because we have structures, we have muscles, we have fat. So this can even change the position of the eyes. So we are talking about very little product that hopefully are not going to cause this type of complications. But that's why it's so important to have someone that's trained, someone that has the knowledge about the anatomy. So then you can end up having the outcome that you want. And this is when I say about, remember I said about looking at yourself in the mirror and recognizing yourself. Imagine if you have a lump, because this is an area that swells so much, even when nothing is done. Fillers, for example, they pull water. So then you can have lumps in this area. And I've seen so many bad ones. And then we need to treat, and the treatments are a bit more complicated. So, and as it lasts, we've seen that it lasts so long. It's difficult for us to say, oh, don't worry, in 6 months it's going to go down.
Yeah. And I think as well, from your perspective, obviously some people are having tear trough filler and they're not having it done by a medical professional. And yes, we'll definitely see people with infection. But one of the biggest that we always worry about is either one, blindness, or two, what we call a vascular occlusion of some kind. So where either the vessel is being squeezed by the filler or whether there's been a direct injection of filler. Have you, because you are an eye specialist, have, so that people don't think that we're just scaremongering and, you know, trying to put people off, have you seen complications from tear trough filler?
I have seen complications. I've read articles saying that complications happen, and I know that these complications are less exposed because, of course, some people sometimes are afraid, but it's important for us to know that complications can happen because then we can do everything to avoid. I think that's the main thing, is knowing what to do to avoid. No one, even the best injector in the world, is they can avoid 100% complications. So because this is a procedure, and if you do any procedure in your body, and this is for any specialty, we are gonna have a possibility so of complication. But the important thing is know how to minimize. So for example, when I said about the needles, one of the ways that we can have first, so there are many ways. So first is knowing the anatomy, so we know where we're injecting. Second, that's becoming very popular, is the use of ultrasound. So then you can map the blood vessels. Third thing is using cannula. So even people that don't use ultrasounds, we can minimize the risk using cannula. So cannulas are similar to needles, but they are blunt in the tip. So then in the end, there is a less chance of perforating a blood vessel and putting the filler inside of the blood vessel. So then there is less risk. So, and this I mean for the vascular occlusions. So I think if you are experienced, if you have good knowledge of anatomy, and if you are willing to learn, because even people that can be possibly like trained, but they are not keen to learn, they can be stuck, and then they can be avoiding complications in less manner, in a less strong way. So I think all of these, so they are very detailed. So there are very little details that in the end of the day, they are really important for any treatment in the face, any treatment in the body, but specifically as we are talking for around the eyes.
Absolutely. And I think as medical professionals, we consent for risks, we discuss aftercare, and we guarantee aftercare. And then also on top of that, there may be cases where we know we're never going to put tear trough filler in because it may not be suitable. And in those cases, especially as medical professionals, the ultimate potential treatment is surgery. And it might be for some patients, we end up referring to surgeons in order to address either the upper or the lower lid. So that is something that we do not necessarily to address today, because we could go on and on and on and on and on about all the different treatments we could do to the eye, but it's about starting with the bottom, very simple, you know, good safety profile treatments such as more of the skincare elements, potentially other injectables like polynucleotides prior to addressing with tear trough, looking at other areas of the face, and then moving on to tear trough if suitable, and then potentially surgery in the future. All of these are on the table when you see a medical professional. Whereas if you do not, they may not be fully aware of what the different options could be and what conditions may be more suitable for a surgical rather than a non-surgical option.
I completely agree. I think this summarizes everything that we discussed today and everything that's in our day-to-day practices.
Absolutely. Well, I know we've talked a lot, and I'm sure there must be some questions. I know some people can be a bit shy about putting a message on in the comments below. If not, and people may not want to, you know, put a direct question in, that is completely fine. We do respect that some people may feel a bit nervous or a bit shy, but if that's the case, same with myself. If you want to send us any messages at any point, you are more than welcome. If it's something that we cannot address to help you with your youthful eye or anything else other than a youthful eye, send us a message. We will do our very best. Because we are medical professionals and we're here to help. And if it means referring you on to somebody else, for example, for extra support, we also do that quite regularly.
Yes, I
Because
think every day I do a referral at least.
Yeah, absolutely. Because we've got your best interests at heart at the end of the day.
Exactly.
And we want you to have, you know, bright, youthful eyes, feel happy when looking in the mirror, and making sure your overall health is really good.
Yes, completely.
And don't forget, tear trough is not always the answer.
Yes.
Think about all other options. So always book in for your face-to-face consults with a medical professional in order to get absolutely everything out of them. And it won't just be, I'm sure the same with you, Dr. Karla, we don't just talk about the eyes and nothing else. We might talk to you about a load of different options to involve the whole face. And you won't necessarily get that just by booking in for a treatment with somebody else. You will have to keep asking question after question, whereas we will address that all as one part of a consultation.
Completely agree with everything.
Well, I don't know about anybody else at home, but I have had an absolutely amazing discussion with Dr. Karla.
I love discussing with you as well.
It's been brilliant, and it's such an important area of the face. You know, the first thing you see with people are either their lips or their eyes, and it's something everyone's very conscious about. So thank you, Dr. Karla. I'm sure this won't be the only time that we end up talking.
Definitely.
But I'm sure people do want to enjoy their weekend a little bit rather than just listening to us.
Yes, definitely.
But thank you so much. I will upload this as a reel, as will Dr. Karla, so you can look at it backwards, and not backwards, but rewatch it. And you don't want to watch it backwards. That would be very bad if you start with the tear trough filler and work your way backwards. But you'll be able to watch it and put any comments below or DM us privately.
Yes. Thank you very much. I really appreciate. I think what you're doing is really good. It's about educating our patients and educating our population. So this is really important.
Oh, you're more than welcome, Dr. Karla. Thank you so much for coming on. And yeah, hopefully this is the first part of a series.
Yes, definitely.
You take care, Dr.
Thank
Karla.
you, everyone that joined as well. Thank you. Bye bye.